A woman from El Paso, Texas is in a medically induced coma after a plastic surgery gone horribly wrong. Our affiliate WVIA spoke to her sister and her fiance about it.
You know, she's physically here, but not mentally here.
On October 30th, Laura Avila was set to have a nose job in Juarez, but when medical professionals injected anesthesia into her spine, it went to her brain.
Finally told me, we called the hospital. The director came and saw her and right away said we need to get an ambulance and get her to a hospital.
She's been in a bed. She hasn't moved.
Laura also suffered a heart attack, and now she's brain dead.
She has a glazed look in her eyes. The doctors don't believe she can see us. We cry every single day, and I think right now we're just shocked and numb and don't want to believe it's true.
Her fate lies on the shoulders of her family and fiance.
Basically, the doctors ran more exams here, and they told us that there's really nothing else they can do for her. That as a family, we need to decide whether we want to remove her from life support.
But they're not giving up hope, trying to transfer her to a facility with more resources in North Texas. They're praying for a miracle, keeping her love alive.
I would have also hugged her harder and told her I loved her.
We actually got married by God in the hospital room, but by the church. I just, no matter what happens, always want her to have a special place in my heart.
To talk more about this is board-certified plastic surgeon Dr. Anthony Youn. Dr. Youn, how often do you see this? Someone leaving the States to maybe save some money on plastic surgery, but no due diligence, and it goes horribly wrong?
Well, we see it, unfortunately, a lot more commonly than people may think. There's so many people that think, look, I'll save a couple of $1,000s, I'll go overseas or go to another country, have my surgery done. But unfortunately, what they don't consider is what are the bad things that can happen with surgery? And unfortunately, you start with death and you go from there.
Mm-hmm. And do the doctors have to be board certified? Let's say in Mexico, where this young woman went for a nose job and is now in a coma?
No, and that's the problem. Here in the United States, we have such stringent requirements. If you're going to be a true board-certified plastic surgeon, it entails years and years of schooling and years of exams. When you go overseas, you don't have that. You don't know what this doctor is even trained in. All you know is that they give you a cheaper price, but you can pay in so many other ways. And unfortunately, that's what happened in this situation.
And even if you do, doctor, some research and you say, okay, I'm confident that they're certified, that they know what they're doing, what you read and what you research may not necessarily be true. What should people look for?
So the most important thing is to look for a doctor certified by the American Board of Plastic Surgery. And if you're thinking about cosmetic surgery, find a member of the Aesthetic Society. Now, once again, if you're going to go overseas, you really have to do your due diligence. A lot of people say, well, I know this patient and this person who may have gotten a good result, but what happens if you have a complication? Who's going to take care of you? And is your health insurance from the United States going to pay for any of that? Probably not.
Yeah, you don't consider complications when you're thinking about this. And what do you say to this family of this young girl going there for a nose job? What is there to do? I mean, she's in a coma there.
Well, the good thing is she's here in the United States now. She is receiving care at a good hospital here in Texas. Really, obviously, praying, hoping, listening to your doctors, and doing what you feel obviously is best for your loved one is the most important thing. But for all those who are watching today, if you're thinking about going overseas or to another country, you really have to do your due diligence and be very careful. I mean, I have not ever met a patient who said, I'm so glad I went to a third world country to have cosmetic surgery. I haven't met any of them.
Yeah, I've heard of people doing it, and you're right. It's not worth $1,000 if that is going to be the result. Dr. Anthony Youn, thank you.